Hello, my name is Lily and I'm a third year nursing student from Newcastle, and today I'm going to take some time and talk through with you some community nurse interview questions and some ways you can answer them. I recently had a community nurse interview. I got the job in the end, which is really exciting. So I thought I'd go through with you some of the answers I gave and some ways you can structure your interview answers when going for a community nurse band 5 interview. I received a lot of positive feedback, so I thought it was a good idea to share some of my ideas and answers with you. I'm going to talk about how you can structure an answer to show how passionate you are about community nursing. Having an interview is really stressful, but there are some techniques you can employ to help calm your nerves on the day. The best way to calm your nerves on the day is to prepare well in advance for the interview. This helps you be more yourself and feel at ease on the day. Make sure you research the trust you're going to work for. Have a look at any social and economic plans the trust has in the near future and try and memorise this as much as you can, but also be aware of the own skills that you have. On the day of the interview, if you're feeling anxious, try focusing on your breathing, taking deep breaths and just focusing on the moment. You can also focus on simple objects around you and just say these objects out loud. This helps focus your brain. Focus on simple things around you, such as colours or objects. I find that this technique helps calm your brain and preserve some energy that you can use in your interview. Next, I'm going to talk about some of the interview questions that you may be asked. So the first question that your interviewer may ask you is, tell me about yourself. This is usually one of the first questions asked during an interview. It's kind of used as an icebreaker, and it helps the interviewer get to know your personality a bit and what sort of skills you have from your previous employment or life experience that you can employ in the role. I personally find that this question can be quite daunting, and that's because it's such a broad question. But if you make sure you research and have an idea of what you want to say prior to going into the interview, this should really help. But if you're well prepared, this is a great opportunity to kind of show a bit of your personality and why you love the job and what sort of skills that you have from previous work experience. So for my interview, this is how I answered this question. Firstly, I introduced myself, I said my age and where I live, and then I went on to say, I'm currently a final year nursing student, and prior to this I was a pastry chef cum chocolatier running my own business. In my first job as a chocolatier, I learnt hands-on practical skills and some fundamental pastry recipes. I then moved to London and worked for a French wholesale company where I honed my teamwork and skills. After that, I worked in a range of bakeries up and down the country. This inspired me to open my own business in 2018. I opened a small chocolate company, and this is where I learned how to work well under pressure and efficiently. I also honed my communication skills when talking to both customers and potential wholesale clients. I also worked part-time in a bakery where I made croissants and cake. I worked in a small team, and this is where I learned how to delegate tasks to ensure that the job was done efficiently. So it wasn't until 2019, when my nana was receiving end-of-life care at home, when I was inspired to do my nurse training. The nurses who looked after my nana were really good. They were really person-centred and really kind and gentle with both my family and my nana. After witnessing the kind of care that my nana and my family received, I decided this was something I wanted to pursue. I wanted to give this kind of high quality care to lots of different people. So I decided to study nursing in 2019, and I've really enjoyed my time as a student nurse. I've developed my communication skills and clinical practical skills throughout a range of placements. I've also received positive feedback from both my practical placements and my academic work. And in the future, I'm really looking forward to supporting future student nurses to make sure they had just as positive experience as I have. And finally, during my time at university to support my studies, I worked in a COVID-19 vaccination centre, and my role was to help reassure patients who were anxious and respond to adverse reactions. This is where I learned how to work really well in a multidisciplinary team, There was nurses, consultants, doctors, healthcare assistants, porters, members of the army who were all involved. At my time at the vaccination centre, I had to work with a really diverse team to meet the needs of the patient. This is where I furthered my communication skills to ensure that I could work well within the multidisciplinary team. Over the past 3 years, I have developed my communication and clinical skills, so now I'm at a level where I feel competent to become a passionate, newly qualified nurse. So that's the end of my answer. So next I'm going to kind of break it down and explain how you can sort of personalise this. I recognise this is a very personal answer. So to break down my answer, I introduced myself and talked briefly about my employment history and kind of intertwined any transferable skills that I had picked up along the way becoming a nurse. And after this, I decided to talk about my own personal experiences and why I was inspired to pursue nursing in the first place. I think this is a really important part of everyone's personal journey to becoming a nurse. I feel like it lets the interviewer know your kind of reasoning for going into nursing, how passionate you are, and the kind of nurse you'd thrive to be in the future. And after this, I then decided to talk about my current role, and this kind of reinforces again why you are qualified for the job you're applying for. Prior to the interview, it's really important that you have a look at the job description and make a note of any skills that you have that are included in this description and name drop them in the interview to kind of tick off and prove that you're qualified for this role. So for example, for the job description I applied for, it said it was mandatory that the candidate worked well in the multidisciplinary team. So I decided to intertwine my experience at the COVID-19 vaccine centre, where I have to work with a diverse multidisciplinary team to meet the needs of patients. And finally, it's good to conclude your answer by rounding it off, saying that you believe that you have the skills and personality for the job you're applying for. So after this, the interviewer may then go on to ask some scenario-based questions. This is where it's really important to do your research and work before the interview, because it's really hard to think on the spot some answers that are scenario based. You'll have a lot of experience and a lot of different stories, but once you put on the spot, it's hard to kind of process and whittle down which stories are appropriate and are structured enough to have a conclusive answer. My advice would be to have a look at your own trust values and think about any times you've upheld these values that I mentioned. So a value that may come up is dignity and respect. So you may be asked about a time where you've upheld a patient's dignity and respect while looking after them. Upholding a patient's dignity and respect is outlined in the NHS Constitution, therefore it's highly likely that it'll come up in the interview. So for this question, I decided to talk about a time where I had to change a patient's catheter and the patient was really anxious. I talked about the different kind of therapeutic communication techniques that I utilised during the scenario. I talked about how I used open-ended questions, the use of silence, the use of therapeutic touch and paraphrasing to ensure that the patient felt at ease before the procedure was carried out. I also mentioned in my answer that I took the time to make sure that I gained informed consent from the patient and made sure that the patient was at ease before the procedure was carried out. To finish the answer off, I reinforced why it was important to uphold a patient's dignity and respect and how this is linked to high quality care. And I also ensured that I discussed the outcome of my scenario. For example, after the procedure was carried out, the patient was very grateful and appreciated the time I had spent explaining the procedure and using therapeutic techniques. The patient also said that they were happy with the care that was provided. So the next question I'm going to talk about is tell me a time where you had to be creative to meet the needs of a patient. I got a bit stuck on this question, but I just asked the interviewer if I could have a little bit more time to think about my answer. And I think this is totally acceptable to do. Just make sure you take the time to think of a well-structured answer for this question. I really wasn't expecting to get this question, but I was fortunate enough to think of a time where I had thought outside the box to meet the needs of the patient. I talked about a time where I was looking after a patient who had a lot of anxiety about using the toilet. This patient in particular used to get really anxious and scared of falling off the toilet and had fallen off the toilet in the past, so was developing a fear of falling again. So after helping the patient on the toilet, the patient began to become really agitated and upset about being on the toilet. This patient in particular really thought they were going to fall again. I can remember at the time I was quite stressed, and I tried to think of all the things this patient liked to help calm her down. And this is when I remembered that this patient in particular loved the Queen and the royal family. So to distract the patient from, while they were using the toilet, I decided to sing along to the national anthem. Straight away, the patient began to sing along to the national anthem, and I was quite relieved because I don't actually know many of the words to sing along. So the patient was, at ease and actually enjoyed her time using the toilet. She was successful in using the toilet this time. So going forward, this patient in particular had a bit of a coping mechanism she could rely on to use the toilet in the future. This not only helped the patient by making her feel more at ease and resolving some of the fears she had, it also had a good impact on the rest of the team. The time they would have taken to assist the patient using the toilet was significantly reduced with this new tactic. Therefore, they were free to do other jobs in the meantime. I recognise this is a really obscure answer to give, and I can remember feeling at the time like I had made a fool of myself and that I shouldn't have brought up such a random scenario. But I guess this is the beauty of nursing. A lot of random, funny, insightful scenarios happen naturally. And I guess these moments should be celebrated, because in the end, this patient in particular was provided high quality care, and this also had a positive impact on the team as well. But it is really important to bear in mind to make sure you don't waffle during your answer, and really reinforce what the benefits were to the patient and the wider team if possible. So the next question I'm going to talk about is, what can you personally bring to the team? I think this is a great question because you can really take your time and illustrate why you personally are perfect for this role, and the sort of passions and interests you have that you'd apply for the job if you're successful. So for me personally, I said something along the lines of, as a previous business owner, I feel like I have developed a lot of skills during that period of my life that I can translate into nursing. Because I worked on my own as a sole trader during my business, I made sure that I knew how to work well under pressure and efficiently. I also learned how to multitask appropriately, and these skills are really important in nurse. It means now when I'm working as a student nurse and a nurse, I don't get overwhelmed when I have many tasks that need to be done. I know how to efficiently prioritise to meet the needs of the patient and the team. Alongside working well on my own during my business years, as a student nurse, I've really honed my teamwork and skills. I've worked alongside a wide multidisciplinary team to meet the needs of the patient and to provide high quality care. And finally, being creative is a big part of my personality. I love to paint and bake whenever I can. I think bringing creativity to a place of work is really positive, because it promotes problem solving and fresh thoughts. I also personally use creativity as a part of self-care. I love to paint and bake, and this helps me feel more relaxed at home. So by caring for myself, this allows me to then care for other people, meaning that I can care for people long term. So that's the end of my answer. And to reinforce, I think it's really important not to be too generic with your answer with this one. Try and show who you are and your personality, and personalize this answer as much as you can. You really want to shine through this answer. If you can, try and make your answer interesting, because that'll help the interviewer remember you. So the next question I'm going to talk about is, what is the role of the community nurse and why would you like to become one? So this question is actually two questions. So to make it a more structured answer, I would separate these two questions and answer them separately. And this will make sure that you don't get confused when you're answering this question. So I would start firstly with what is the role of a community nurse? So with this answer, you really want to show that you have a good understanding, a good realistic understanding of what exactly a community nurse does day to day and what kind of barriers they may face. So for example, you may say something along the lines of, the role of a community nurse is really diverse and different day to day. And this is one of the reasons why I would be interested in becoming a community nurse. I think that it's a really interesting environment to work in, working in an individual's home. I really feel like you can build a strong therapeutic connection going into someone's home day in, day out, building up a strong relationship. This ensures that the care that you are given is high quality and therapeutic. I also understand that it can be possibly quite stressful working as a lone worker, as a community nurse. Therefore, it's important to prioritise your workload and to communicate well with colleagues, to delegate when need to, and help out others when it's required. I'm personally interested in end-of-life care, but there is lots of different duties that is entailed in community nursing. So secondly, for the next question, why do you want to be a community nurse? And this answer is going to be very personal to you. So like I was saying earlier, I was inspired by some previous nurses who'd cared for a family member. So try and be specific with your answer to this one. It might be because you really enjoyed a practice placement that you had, and maybe because you felt like you had a direct impact on a patient's life when you were looking after them in their own home. So try and make your answer as personalised as possible. So next I'm going to talk about some final tips that should help you through your interview process. So here are some tips how to ace your interview. Firstly, try and relax. I know it's hard, but just try and relax. Take deep breaths. If your interviewer is good, then they should put you at ease. That's kind of their job during an interview. But if you are really nervous, just let the interviewer know, and hopefully they'll set aside some time to try and calm you down a bit. They should try and assist you through the interview process. And next, try and be yourself. By being a bit more relaxed, you're more likely to show your true personality and really shine through the interview. And just try and remember, they invited you for the interview. You've already kind of passed the first hurdle. That's possibly the hardest part. They're interested in you and the skills and personality that you have. And they are interested in getting to know the real you. And finally, if you get lost in one of your answers, try and link it back to the 6 C's of nursing. It's always a good core fundamental part of nursing to draw back on. And also try and say why that's important to you. I really hope you enjoyed my video on community nurse interview answers and kind of give you a bit of an insight on how to structure and plan your own interview answers. Thank you for taking the time to watch my video.